देखना भाई, मॉडल ड्राइव करते करते कुछ खेलेगा क्या भाई?
चलेगा।
देखना तुम।
तो
एनएनएफ के सर पे ना आ जाए, किसी को टोक नहीं देना भाई तू।
we are live now.
Yes.
Yeah. So on behalf of NNF Gujarat, I, Dr. Prashant Karya, welcome one and all to today's Kaun Banega Champion, a KBC season 1. So today we are having with us our advisor Dr. Somshekhar sir and the quiz masters Dr. Ronak Patel, Dr. Mohit Sani and Dr. Kunal Ayya. Along with that, we do have our scorer Dr. Krunal Shah, and all the 5 teams they have joined. So without taking much of a time, I request Ronak to proceed. Thank you.
Okay. Thank you, Prashant bhai. A very good afternoon to all of you in this very hot climate. I would like to share the screen. Is it visible?
Yes, visible. Hit full screen.
Okay, at the outset, I would like to thank NNF Gujarat to provide the opportunity to conduct quiz for practicing neonatologists as well as the pediatricians across the Gujarat. I also thank our president and secretary, Dr. Sandeep Trivedi and Dr. Prashant Karya, both for providing the opportunity. I also thank both of our respected advisors, Dr. Somsekhar Nimbalkar sir, as well as Dr. Ashish Mehta sir. We have, along with me as a quiz master, Dr. Sani and Dr. Kunal Ayya. And scorer, we have Dr. Kunal Shah from Vapi and coordinator Dr. Prashant Karya himself. Okay, so basically the concept of Kaun Banega Champion was developed by our secretary. The purpose of the quiz is to develop the interest in the academics in the neonatology. So we have total 5 teams from the Gujarat, 1 team from each zone. We have total 5 zones. So I request team members from the North Zone to quickly introduce yourself. Just name and city where you are practicing. Quickly. From North Zone, Dr. Milind.
Hello, I am Dr. Milind Thakkar from Gandhidham, Kutch.
Okay, Dr. Monil.
Sir,
Hello.
he is.
Okay.
Sir, he is busy, so
Okay,
he may
no
join
issue.
later.
Okay, no issue, no issue. From South, we have Dr. Tushar.
Good afternoon, everyone. I'm Dr. Tushar. Good afternoon, everyone. I'm Dr. We are from Surat.
Yes, please welcome. And from Central Zone, we have Dr. Mohammad Gandhi and Dr. Afsana Patel.
Hello everyone, I'm from Vadodara.
Hello everyone, Dr. Afsana from Baroda.
Welcome. From Ahmedabad Zone, we have Dr. Ankur Patel as well as Dr. Dipen Shah.
I'm Dr. Ankur Patel from Setu, Ahmedabad. Dr. Dipen Shah from Setu, Ahmedabad.
And from Saurashtra, we have Dr. Jatin Unadkat and Dr. Nikesh Karsaria.
Hello, I am Dr. Jatin Unadkat from Rajkot, Mahi Newborn Care Center.
Please have a big round of applause. Digital round of applause. So when there is a game, there are certain rules and which are to be followed. Already the rules and instructions and format have been conveyed to you, but we'll just quickly go through all the rules. You will have a questions only related to the neonatology. Okay. It will have a visual questionnaires also, and there will be a total 5 rounds. Tiebreaker round if 2 teams are having similar marks. And timer will run on the screen. There will be a 15 and 20 second timer. And last round, that is fifth round, will be of rapid fire questions. And final decision in case of any dispute will be of quiz master. You will be given 10 marks per correct answer. There are no negative markings. All questions will have a 4 options. Give the answer as an option number only. You are not supposed to say whole sentence. Only say like my answer is second or my answer is third, like that only. Okay, and that answer must be stated before the end of the timer. Passing of questions to the next team will not be there. And very important instruction is kindly mute your audio and video both off when other team is playing. Okay. And no other team will speak unless they round. Otherwise, that team will be disqualified for that round. And in case of any technical error, oral questions will be asked with a similar marks. In a rapid fire round, there will not be any options. You will have a 20 questions and 1 minute time in a rapid fire round. If you don't know the answer, then say next. So quiz master will ask the next question. And rapid fire round will stop at 1 minute or whenever you finish the 10 question, whichever is the earlier. Okay. So when there is a game, there has to be someone to open the inning. So to make equal justice to all teams and select the team randomly, we will do the naming ceremony of all the teams. For naming ceremony, I request Dr. Somsekhar sir to help me, please, sir.
Thank you, Dr. Ronak. So in this bag here, there are 5 teams in slots. So you can see that. I will speak one by one, and Ronak will give them the name. So I am picking the first one. So let me check the first one. I don't know if you can read. My handwriting is pretty bad. But this says South. I don't know if you can read it. But this says South.
So the South team, Dr. Tushar Poshia and Dr. Sirish Kapadia, your team is Premature Panthers.
So the next one, let's pick up. Next one would be.
So South team, rename your team as Premature Panthers.
Done.
Okay. Now the next one is Ahmedabad. I don't know if you can see it.
Okay. So Ahmedabad team, Dr. Ankur and Dr. Dipen Shah, please rename yourself as a Meconium Masters.
So now the next one is North Zone.
So Dr. Milind and Dr. Monil, you are Hyperbill heroes.
Okay.
Should have kind of an IPL-like structure, I understand.
Yes.
So the fourth one is now Central Zone.
Central Zone, Dr. Mohammad and Dr. Afsana. Septic Showman.
And of course, we know the last one now. So that would be Saurashtra, I suppose.
Yes.
Yeah, Saurashtra.
So Dr. Jatin and Dr. Nikesh, please rename yourself as a Precious Premise.
Thank you. Over back to you.
Thank you, sir. I hope all teams have been renamed. I request our scorer, Dr. Kunal Shah, also to take a note of these names. So there will not be any mistake. Yes. All participants, shall we move ahead?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So your round will be like this only. The first question will be asked to premature panthers. In this order only you are supposed to play. Okay, in second round the first question will be asked to premature panthers. In third round also the first question will be asked to premature panthers. Okay, in this order you are supposed to play. Is it okay? So I hope I have been cleared. So here is a demo question. I will show how the question will be asked. So this is the initial slide, okay, in which that left upper hand corner, you will have a round number with a red mark and question number with a green mark, that question number, and your team name will be appeared here. You will have a question in this white portion like this. I will read whole question like, what do you mean by a neonate? And as soon as I finish the question, on a next click, your options will appear like this. You will have a 4 options from 1 to 4. I will read all 4 options also, like is less than 10 days, is less than 15 days, is less than 20 days, and is less than 28 days. As soon as I finish the last option, on a next click, your timer will start. So for a first round, you will have a 15-second timer. So before the end of, as soon as the timer finishes, you are supposed to state the answer, like my answer is 4. You are not supposed to say the is less than 28 days. You are only supposed to tell the option number, that's it. Is it clear?
Yes.
Team premature panthers, is it clear?
Yes.
Okay. So best of luck to all the teams. Is there any query till now to any participants?
We are ready.
No, sir.
Okay, sure. So best of luck to all.
I just
We'll start with the round 1.
Yeah,
Ji?
I request everyone except premature panthers to switch off the videos, so that it becomes easy for us to monitor. Yeah. Hyperbill heroes, switch off the video.
Switch off the video. Hyperbill heroes, please.
Milind bhai.
Done. So now premature panthers visible clearly. Ronak, you can start.
Yes. So premature panthers, here is your round number 1 and question number 1. Okay. So your question is, a newborn presents with a subconjunctival hemorrhage. The treatment is, and your options are no treatment, antibiotic eye drops, antibiotic and steroid eye drops, and aspiration. And your time starts now.
My answer is 1. Hello.
Okay. So you have selected first.
Yes.
Okay, we'll see the answer. Absolutely correct answer.
रौनक खाली एक चीज सॉरी नीचे ना
चैट डिसेबल कर दिया, चैट डिसेबल कर दिया,
कर दिया ना। हाँ, क्योंकि वो
डिसेबल कर दिया, लोग आंसर देना चालू कर दिए थे, मैंने तुरंत डिसेबल कर दिया।
वो पार्टिसिपेंट बाकी के जो स्पेक्टेटर्स है ना, वो भी आंसर लिख रहे हैं चैट में फटफट करते हुए। इसीलिए चलो ठीक है।
वन कैन चैट, एक बार चेक कर सकते हैं।
Okay, have you done with it, प्रशांत भाई?
चैट डिसेबल हो गया।
Okay, shall I move?
Continue.
Is
it done?
I think so. Done.
Okay. So move ahead with your
Panthers. Switch on your videos.
Premature Panthers? Okay.
Yes.
Still the round 1 continues for premature Panthers.
Okay.
You will have a time to switch on the video and audio both, no issue. Huh?
Okay.
Premature Panthers. Premature Panthers. You have a second question for round 1. Okay, your question is, so here is a clinical picture of a baby. Name the most probable syndrome in this baby, and your options are Klippel-Trenaunn-Weber syndrome, Beckwith-Wiedemann syndrome, neurofibromatosis, and Sturge-Weber syndrome. And your time starts now.
My answer is 2.
So you have chosen second.
Yes.
Okay. So very unfortunate. Actually, Klippel-Trenaunn-Weber syndrome had a port wine stain and abnormal overgrowth of a soft tissue with a vein malformation. So this baby is having Klippel-Trenaunn-Weber syndrome. You will not get 10 marks for this. Okay, we'll move ahead with Team Meconium Masters. Premature Panthers, please switch off your video and audio both. Meconium Masters, please switch on your video as well as audio.
Yes. Yes, sir.
Meconium Masters. Are you ready?
Yes. Yes, sir.
Okay, so here is your first question. A cyanotic baby with bradycardia and irregular respiration having flexion of upper limbs, not responding to stimuli, what will be the Apgar score? And your options are 2, 3, 5, or 4. And your time starts now.
Yes. My answer is 2.
So you have selected number 2, second option.
Yes.
Okay, absolutely correct answer. Correct answer. You will get 10 marks for this. Shall I move ahead with the second question, Meconium Masters?
Yes, sir.
Are you ready?
Excuse
Excuse me, sir, but they answered after the timer was up.
It's okay, Mohammed. Fine. Technical glitch.
What happened?
Ronak, continue.
Okay. Meconium Masters, please switch on your video, audio both.
It's on, sir.
Yes, you have a second questions.
Yes.
Okay, are you ready?
Yes, yes, sir.
A newborn with this lesion, which is the ideal age of repair, and your options are 0 to 6 months, 6 to 12 months, 12 to 18 months, and more than 2 years. And your time starts now.
My answer is 3.
So you have selected third option,
Yes.
12 to 18 months. Okay, so we'll see the option.
Okay, 6 to 12.
6 to 12 months is the ideal age of repair. So you will not get any marks for this. Okay.
Yes, more than 2 years.
Meconium Masters, please mute yourself and put your video off. Hyperbill Heroes.
Yes, sir.
Please unmute yourself and switch on the video. Hyperbill Heroes.
Done, sir.
Yes, sir.
Yes, okay. So you have a first question. What is the ponderal index of child with weight of 2000 gram and length of 50 centimeter? and your options are 1.6, 2.6, 3.6, and 4.6. And your time starts now.
मिलिंद भाई फॉर्मूला याद है?
Huh? Weight by height cube into 1000. 2.6. My answer is 2.
Your answer is second. Your answer is second option.
Yes. I was not able to calculate. Weight by height cube into 1000.
Yes, your formula is right, but I think you should think of that 2000 gram and 50 centimeter is asymmetric IUGR.
Asymmetric. Less than 2.5.
Yes, yes, exactly. So we'll move ahead with the second question. Shall I move?
Yeah.
Okay. So here is a X-ray of umbilical lines, site of umbilical venous catheter tip, and your options are splenic vein, left renal vein, left hepatic vein, and hemiazygous vein. And your time starts now.
Tip is going upwards, મિલિંદ ભાઈ.
બોલો વાંધો નહીં, તમે આન્સર આપો, મને કન્ફ્યુઝન છે.
My option is 4, hemiazygous vein.
The correct answer is left renal vein. Okay. Sorry, hyperbole rose, both the answers are, you will not get any marks. Okay. Can you please switch off your video and audio both? We'll have a next team, septic showman. Please switch on your videos and audio both. Septic showman.
Yes, sir.
Central zone. Yes. Okay. Are you ready for first question?
Yes, sir.
Here is your question. All of the following can occur in a neonate for heat production except, and your options are shivering, breakdown of brown fat, universal flexion like fetus, and cutaneous vasoconstriction. And your time starts now.
Sir, our answer is first.
So the first option is your answer.
Yes.
Shivering. Absolutely correct. You will get a 10 marks for this. Shall I move ahead with the second?
Yes, sir.
Okay. So there is a erect abdomen X-ray of a neonate presented with vomiting.
Okay.
What can it be? And your options are congenital hypertrophic pyloric stenosis, duodenal atresia, jejunal atresia, and malrotation. And your time starts now.
Duodenal atresia.
Answer 2.
2.
So you have chosen second option.
Yes.
Can I ask why you have chosen the second option?
Sir, double bubble sign.
Absolutely correct. Absolutely correct. So you will receive again 10 marks. We'll move ahead with the next team. Please unmute yourself. Septic showman, please mute yourself and switch off the video. Team Precious Premise. Team Precious Premise. Yes, Dr. Jatin and Dr. Nikesh. Unmute yourself and switch on the video. I'm not able to see.
Yes, sir.
I'm able to see both. Fine.
Okay. So are you ready for first question?
Yes, sir.
Most common cause of neonatal meningitis is, and your options are Staphylococcus, E. coli, H. influenza, and pneumococcus. And your time starts now.
My answer is 2.
So you have chosen second option. and it's correct. So you will get 10 marks for this question. Are you ready for the next?
Yes, sir.
Okay. So here is an X-ray of an umbilical arterial line. Where is the tip of umbilical arterial line most probably located? And your options are left external carotid artery, left subclavian artery, left common carotid artery, or a brachiocephalic trunk. And your time starts now.
That's subclavian. Our answer is 2.
So second option you have selected. Absolutely correct. Why you have selected? Can I ask?
Yes, sir. It was going outside in the subclavian area. Actually, we don't know the citation.
Okay, no issue. Thank you so much. I think round 1 is finished now. I shall stop sharing the screen, and I request our scorer, Dr. Krunal Shah. Are you ready with the score, Dr. Krunal? So by the time Dr. Kunal is ready with the score, I request Dr. Mohit. Okay.
Premature Panthers 10, Meconium Masters 10, Hyperbil Heroes 0, Septic Showman 20, and Precious Premies 20. Yeah, thank you.
Okay. Okay.
Krunal, I have already shared.
Okay.
Dr. Kunal, stop sharing.
Okay.
Okay. I request Dr. Mohit sir to proceed with the second round.
Able to see my screen?
Yes, perfect. Second option, Mohit bhai. हाँ.
Okay. So now the teams are ready. Premature Panthers, please switch on your videos and your this thing, audio also, please. So you
Yes,
are
sir.
ready? Visible?
Yes, sir.
You're ready? Okay. We'll start with the question, and this is question number 1 for round 2 for Premature Panthers. Which of the following reflex it is not present at birth? Okay, this is your question, and your 4 options are asymmetric tonic reflex, Morer's reflex, symmetric tonic neck reflex, and cross extension reflex. And your time starts now.
My answer is 1.
Pardon? Sorry?
My answer is 1.
Okay. So let's see what's your answer. So it's unfortunately a wrong answer. It's basically symmetric tonic neck reflex. So we'll move on to the next question. Are you ready for the next question?
Yes, sir.
Okay. So this is round 2, question number 2 for Premature Panthers. Your question is, are you able to visualize this image?
Yes, sir.
Okay, the question is a sagittal section of brain USG of a neonate. Which is this condition among following, like among all the conditions which we are going to give you the option? What is this condition? Grade 1 IVH, periventricular infarct, grade 2, and the 4th option is. So your time starts now.
My answer is 3.
Your answer is?
3.
3. Okay. So this is correct. So this is actual clap we are giving. So this answer is correct. Okay, fine. Now this is your question number 3, round 2, premature panthers. Respiratory distress syndrome in a newborn is characterized by all except severe hypoxia, number 1, presents within 7 days after birth, number 2, reticulonodular pattern on X-ray chest, number 3, hypertension prevents ARDS, number 4. Your time starts now.
The answer is 4.
Answer is
4.
तुम्हारी आवाज सही नहीं आ रही यार. क्या है?
Four, sir.
Number
He said
4.
4.
Okay. So sorry, this is the wrong answer. It presents within 7 days after birth. Check. So 3 questions are over. Okay. So now will be the next team, Meconium Masters. So premature panthers, please switch off your videos, and Meconium Masters, please switch on your videos and audio.
Yes, sir.
Way on. Chalo, badhiya. So this will be your question number 1, round 2. A baby on examination shows unilateral morus reflex with positive palmar grasp reflex. The site of the lesion is
Complete
C1, C2, C3, C4, C5, C6, C7, C8. And your time starts now.
Positive. Answer is 3.
So your answer is 3. So let's see what's correct. Good. Nice. So we move on to the next question. Question 2 for the Meconium Masters, round 2. Are you visible? Are you seeing this image?
Yes, sir.
Okay, fine. So this is your question. Neonate found to have with this lesion since 1 week. Which treatment is the most ideal for this baby? Options are petroleum jelly and mineral oil, cotimazole cream, fluconazole cream, any baby shampoo. Your time starts now.
Answer is number 1.
Number 1. Great. Good. So now your question number 3, round 2, Meconium Masters. Meconium passage, see, आपके टीम का क्वेश्चन आ गया. Meconium passage in utero leads to which of the following? Listeriosis, obstructive emphysema, pathological jaundice, Meconium ileus. Your time starts now.
Our answer is 2.
Answer is 2. Okay, let's see. Yes. Great. Congratulations. Well done. So now next team is Hyperbil Heroes. So they can switch on their video and audio.
Yes, sir.
हो गया. तेरा दूसरा कहाँ गया भाई हीरो?
Yes, sir.
He is alone.
Okay. Fine.
दोनों है sir.
दोनों हैं. Fine. चलो. First question, round 2. Parachute reflex disappears at 3 months, 6 months, 9 months, never. Your time starts now.
Onil bhai.
I think 9 months or never बीमारी actually 9 months.
So राखो जल्दी के.
Option is?
My answer is 3.
3. Okay. Let's see.
Never.
Sorry. It's fine. We move on to the other question. Let's try for that. So this is question number 2, round 2 for Hyperbil Heroes. ये दिख रहा है image? You are able to see the image?
Single umbilical artery.
Okay. This is a cross section of umbilical cord. Which of the following lesions is the most commonly associated? Okay. Ventricle septal defect, vesicoureteral reflex, spinal deformity,
Monil by renal dysplasia.
Renal dysplasia.
My answer is 4. My answer is 4.
Okay.
Oh,
okay. Sorry for this. We will move on to question number 3. And yeah, question for hyperbole heroes, round 2, question 3. Which of the following is the least important prognostic factor in congenital diaphragmatic hernia? Least important prognostic factor. Options are pulmonary hypertension, delay in emergent surgery, size of defect, gestational age or diagnosis. Your time starts now.
I think million by 2. Rest of the 3 are important factors.
My answer is 2. Delay in emergent surgery.
Answer is
2.
Answer is 2.
Yeah.
Hello.
Answer is 2, sir.
Okay, fine. Yes, great. So your answer is correct.
Khatu khulyo.
Chale, round 2 now. Septic showman. Chalo bhi septic. Video on, audio on. कहाँ गया यार मेरे को ना इक्वलाई दिख रहा है ना
मोहित भाई दिख रहे
मेरे को अच्छा okay fine question 1 persistence of Morris reflex is abnormal beyond the age of 3rd month 4th month 5th month 6th month your time starts now
beyond 6 months is abnormal. Okay. Huh? 4th, sir. Answer 4th.
So your choice is 4. Good, great, well done. Question number 2 for septic showman. Are you able to see the image?
Yes, sir.
Newborn with asymmetric red eye reflex with leukocoria right eye. What can be the commonest cause? Your options are congenital glaucoma, retinoblastoma, congenital cataract, retinal detachment. Your time starts now.
Commonest D and C versus B. Second lecture, retinoblastoma. Sir, answer 2.
Answer 2. Option 2. Okay, great, good, well done. Third question, round 2. Chronic lung disease in infancy is defined as tachypnea persisting for more than 2 weeks, need for supplemental oxygen at 36 weeks of corrected gestational age, presence of bilateral chest inflate on X-ray chest for 2 weeks, reticulogranular pattern on X-ray chest for 6 weeks. Your time starts now.
Answer 2.
2.
Okay, good, well done. So your 3 questions are done. Next team is precocious preemies. Please switch on your videos and audio.
Yes, sir.
Okay, great. Let's start with your question. Swallowing breathing reflex it not seen in fetus for 12 weeks, 14 weeks, 16 weeks, appear in all above period. Your time starts now.
4. Our answer is 4.
Your answer is 4. Okay. Sorry, it's incorrect answer. It's 12 weeks. We move on with the next question. Are you able to see the image?
Yes, sir.
Okay. Newborn found to have such hand and feet. Which syndrome it can be mostly? Most likely syndrome is trisomy 21, trisomy 13, Edward, and Torch syndrome. Torch sequence, yes.
Our answer is 3.
3. Great, good, well done. So your last question for this round 2. 3.5 kg term male baby born of uncomplicated pregnancy, respiratory distress at birth. X-ray showed ground glass appearance, not responded to surfactant. Echo findings revealed nothing abnormal. Culture is negative. History of 1 month female sibling died before. What is the diagnosis? PAPVC, Meconium aspiration, Neonatal pulmonary alveolar proteinosis, diffuse herpes simplex infection. Your time starts now.
Our answer is 1.
1. Okay. Sorry, it's wrong also. Very clearly it was been written, echo finding reveals nothing abnormal. तो किसी अकलमंद ने किया होगा शायद. Okay, fine. So your 3 questions ends here. Okay, so we are done with the round 2. And over to you, Ronak, for your third round.
Krunal will share the score first. Yeah.
Round 2 score, premature Panthers is 10, Meconium Masters is 30, Hyperbil Heroes are 10, Septic Showman is 30, Precious Premise is 10.
So at present, Septic Showman leading with 50, Meconium Master with 40, Precious Premise with 30, Premature Panthers 20, and Hyperbil Heroes 10. Come on.
Hyperbil Heroes.
Kunal, please stop sharing. Yes. So we'll move ahead with the third round. Are my slides visible?
Yes, yes.
Okay. So team Premature Panthers, please unmute and switch on the video. Here you will have a 20-second timer and a 1 clinical question. I'm not able to see them. Team Premature Panthers, are you there?
Yes, sir.
Yes. Okay. Shall I move? And here is your question. A 3-day-old male infant is noted to have a poor feeding and hypotonia. There was a difficult labor with Apgar of 3 and 7 at 1 and 5 minutes. He is mildly tachypnic and chest X-ray showed slightly enlarged cardiac ciliary. The serum glucose is 12 and urine is positive for ketones. The most likely diagnosis is, and your options are infant of diabetic mother, glycogen storage type 2, hypothyroidism, and congenital hyperinsulinism. And your time starts.
My answer is 1.
So you have selected first option. Let us see what is the answer. Unfortunate, it's an glycogen storage disease type 2. Baby is having cardiomegaly, hypotonia, respiratory distress, everything. So it fits in that. Now we'll move ahead with the Meconium Masters. Premature Panthers, can you? Yeah, okay. Meconium Masters, are you ready?
Yes, sir.
We have a clinical questions and 20 seconds. Your question is, a 3-day-old female infant is transferred to your service with a bilirubin of 23 total and 0.6 direct. She is born at term with Apgar score of 8 and 8 at 1 and 5 minutes. Physical examination is normal except for icterus. Infant's blood group is O positive and mom is B positive. Coombs is negative. CBC is 12,000 WBC and hemoglobin of 15 gram percentage and platelet of 2.35 lakh. Metabolic profile showed sodium of 135, potassium 4.2, urea nitrogen is 10, creatinine 0.2, albumin, AST and ALT are normal. The best management strategy and your options are intensive triple surface phototherapy, exchange transfusion, intensive phototherapy and immunoglobulin.
Our answer is 1.
Okay, before timer starts, you have selected. Sorry for that. At 3 days, without any risk, full-term baby at bilirubin of 23, you are supposed to do exchange transfusion. And PUMS is negative, so no need of immunoglobulin.
No need of immunoglobulin, yes.
Okay. Please. Yes, okay. Hyperbil heroes, are you ready?
Yes, sir.
Yes. You will have 20 seconds. And your question is 1.2 kg preterm baby is edematous on examination. The serum sodium is 120 and creatinine is 1.5 milligram, 1.4 milligram per deciliter. Urine output for 24 hours is 180 per ml. The urine sodium is 40 and creatinine is 14 milligram per deciliter. The FENA would be, and your options are 3.0%, 0.33%, 3.3%, or 1%. And your time starts now.
Milind by 3.3?
0.33 also. Na?
Okay.
Okay, sorry, your time is over. Your time is over.
Okay.
So what is your answer? You will not get 10 marks, but what is your answer?
Answer 2, 0.33.
Yes, absolutely correct, but you will not get any marks. Huh?
Yes, sir.
Okay. So team septic showman.
Yes, sir.
Ready?
Yes, yes.
All of the following about vitamin D are false, except your options are human breast milk is good source of vitamin D. Second is 125D form is more preferable to measure than 25D form of vitamin D, nutritional vitamin D deficiency. Third option is the 1-alpha hydroxylase is upregulated by parathormone and hypophosphatemia, whereas hyperphosphatemia and 125D inhibits this enzyme. And fourth option is 1-alpha hydroxylase is deficient in type 2 vitamin D dependent rickets. And your time starts now.
Sir, answer is 2.
Okay, so you have selected second. Sorry for this. You will not get any marks. Okay. Team Precious Premies.
Yes, sir.
Team Saurashtra. Ready?
Yes, sir.
Your question is, following all about Meconium aspiration syndrome are false, except your options are Meconium stained amniotic fluid is equal to Meconium aspiration syndrome. High frequency oscillatory ventilator is the initial preferred mode of ventilation. Intratracheal suction is recommended in non-vigorous babies, and Meconium is sterile. And your time starts now.
Our answer is 2.
So you have selected second option.
Second option, yes, sir.
Let us see the answer.
Yeah.
So Meconium is sterile. Rest all are false. Okay. So I think it's an finish of round number 3. I will stop sharing. And I request Dr. Kunal to update the score.
The score on the round 3 is Premature Panthers is 0, Meconium Masters is 0, Hyperbil Hero is 0, Septic Showman is 0, Precious Premies is 0. And the total till round 3 for team Premature Panther is 20, Meconium Masters is 40, Hyperbil Hero is 10, Septic Showman is 50, and they are leading. Precious Premies is 30.
Very good. I request Dr. Mohit sir to move ahead with the 4th round.
Okay. Everybody is ready? Chale. Let's start with the round 4. Everybody is able to see the screen? Screen दिख रहा है सबको?
Yes, sir.
Visible, visible.
Okay, great. Premature Panthers, round 4. Please switch. Okay. चलो भाई अब फाफड़ा और खमनी या जो भी है अपना सुरती लुचो खा के अब ये राउंड करो भाई. तुम लोग ये सब कुछ लेके हमारे पास ही आ जाते यार, पहले 100% स्कोरिंग हो जाता तुम्हारा. Okay, fine. Let's start with this. Are you able to see the picture?
Yes, sir.
Great. So brain USG showed this abnormality in newborn. Which is this lesion? Choroid plexus cyst, grade 3 intraventricular hemorrhage, periventricular leukomalacia, periventricular hemorrhagic infarct. Time starts now.
My answer is 1.
Answer is 1. Okay. Sorry, it's the wrong answer. It's periventricular leukomalacia. Fine. Meconium masters, please switch on your videos and audio.
Yes, sir. Yes, sir.
And premature panthers will switch off your videos, please. Great, thank you. Okay. Are you able to see this video? Great.
Yes, sir.
Name of this view in 2D echo of newborn. Yes, view को क्या कहते हैं? What is the name of this view? You got the question?
Yes, sir.
Apical 4-chamber view, 5-chamber, apical 5-chamber view, parasternal long axis, parasternal short axis. Your time starts now.
Our answer is 3.
Answer is 3. Good, great. Fine. So the next is hyperbole heroes. Please
Yes,
switch
sir.
on. Fine. Are you able to see this?
Yes, sir.
Great. Brain USG in 26 weeks gestation baby. Which of the following vessel is most vulnerable to bleed in this baby? Anterior choroid artery, terminal vein, medullary vein, middle cerebral artery. Your timer starts now.
1/4.
Your answer is?
1 नहीं મિલિન ભાઈ.
Okay.
I am not sure. તમે sure હો તો તમે આપી દો.
ના વાંધો નહીં. My answer is 1, anterior choroidal artery. 1,
Okay,
sir.
your answer is 1. Fine.
Oh.
So yeah, but it's 2. Terminal vein. Okay, sorry for this. Next, septic showman. Please switch on your video and audio. Are you ready?
Yes, sir.
Okay. Are you able to see the picture?
Yes, sir. Yes.
Okay, good. 2D echo of an extreme preterm baby who needed 1 dose of surfactant and increased need of O2 at 42 hours of life. What is this finding? The options are severe PPHN, tricuspid regurgitation, patent ductus arteriosus, normal parasternal short axis view.
Sir, answer 3.
3.
The answer is 3. Good. Good. Well done. So, precocious premise.
Yes, sir.
दिमाग में precocious puberty निकलता है, मुंह से premise बोलना पड़ता है. Okay, fine. Your question starts now. So this is the image. Are you able to see the image?
Yes, sir.
Okay. Cranial USG or 24-week gestation baby, which is this section of the scan. Okay, which is this section of head ultrasound. And grade of the hemorrhage. What is the grade of the hemorrhage? This is coronal section grade 2 bilateral, sagittal section grade 4 bilateral, coronal section grade 4 bilateral, sagittal section grade 3 bilateral. Time starts now. Pardon?
Sir, our answer is 3.
Answer is 3.
3.
मेरे को यार तुम्हारी आवाज क्लियरली सुनाई नहीं दे रही. आप
Answer
दोबारा
is
बोल.
3.
3.
I said 3.
3,
3.
sir.
Okay, fine. Yes, good, great. So the round is over. I will stop sharing and request Dr. Kunal to please share the screen for the latest updated scores.
The score for this round is Premature Panthers is 0, Meconium Masters is 10, Hyperbill Hero is 0, Septic Showman is 10, and Precious Premies is 10. And the total score till round 4 for Premature Panthers is 20, Meconium Masters is 50, Hyperbill Heroes is 10, Septic Showman is 60, Precious Premies is 40.
खतरनाक है भाई. ये क्या कहते हैं वो अपना बड़ौदा का क्या फेमस है ना, बाखरवड़ी. ज्यादा
ये सब लोग कट्टू
पेंडा
कटे.
पेंडा.
सर जगदीश
चिवड़ो सर.
चिवड़ो, हाँ वो मेरे को अच्छा नहीं लगता. इसे नीलो
खट्टा
चिवड़ो,
मीठा होता है सर.
नीलो चिवड़ो मेरे को अच्छा नहीं लगता, इस करके मैंने नाम नहीं लिया उसका.
मोहित भाई ये सब लोग कट्टू कटे हैं क्योंकि कुणाल के राउंड में 100 मार्क्स मिलने वाले हैं.
हाँ.
तो कुणाल का राउंड इज डिसीजन राउंड मतलब. और आपने बोला था ना मोहित भाई स्टार्टिंग में कि कोई नहीं आएगा, यहाँ पे 85 है, यूट्यूब पे भी बहुत है. तो सब लोग एकदम परफेक्ट वो परफॉर्म करना. थैंक यू.
चलो बड़े. तभी देखो, तभी कुणाल टाई लगा के आया भाई. हम कुछ नहीं लगाए. उसका सबसे
फाइनल मेरा होगा सर.
Kunal, before you start, just give a few instruction to the team because it will be a fast and furious round.
Okay.
Huh?
So
just in short.
Yeah, sure.
अच्छा, सॉरी, इसमें खाली ये बता देना, स्कोरिंग पहले नहीं बताना है ना, स्कोरिंग एंड में बताना है. वो कुणाल को बता देना.
आंसर सर बोल दूंगा इसके बाद, बट जो स्कोरिंग है ना सर उसके लिए एंड में ही करेंगे. फाइनल स्कोर डिस्प्ले तभी होगा.
Okay.
Okay, so is my screen visible?
Yes, visible.
Okay, so you are all going to have an adrenaline rush now because there will be 10 questions in each round, and try to answer maximum possible number of questions. If you don't know the answer, just tell pass. I will move on to the next question because there are fixed 1 minute timer will be there. I will start the timer, and after that I will quickly start on asking you all the questions. If you know the answer, just tell your answer. We'll immediately move to the next question. If you don't know, just say pass and we'll move to the next question. Either if you finish first 10 questions or 1 minute is over, then that round is over. So maximum 1 minute is there, and whatever number of questions you can answer. Maximum 10 questions are there. And each question will carry 10 marks. A total of 100 marks are there for this round.
There are no options for these questions, huh?
Yes. Yeah, there are no options. So you will not get 1, 2, 3, 4. You have to just straightforward. You have to tell the answer. So premature panthers, please switch on your audio and video.
Yes, sir.
Okay, great. So best
Yes,
of
all
luck.
can switch off the video.
Yeah, best all please switch off. Okay, so your time starts now. First question, which vitamin is deficient in human milk in comparison to cow's milk?
Vitamin D and K.
What is the neonatal mortality rate in India?
Around 33%.
Most common type of top with esophageal atresia.
Type C.
Most common complication of periventricular hemorrhagic infarct is
PVL.
dose of magnesium sulfate for 28 weeks pregnant mother in labor.
4 gram loading dose over 3 hours, followed by 1 gram per hour. Total 24 hours for still delivery.
2 absolute contraindications of delayed cord clamping.
Immediate require research.
Your time is over.
And
your time is over. So answer for question 1 is vitamin.
Kunal, just a minute. They have started to give answer for 6 questions, so let them complete 6 questions.
Okay, sure.
Yeah, premature panthers, complete the answer.
Immediate require resuscitation and cord rupture.
For second is
Rupture of cord rupture.
okay. So the first answer is vitamin B. Neonatal mortality rate is 20. Third answer is type C. Fourth is porencephalic cyst. Answer for fifth question is 4 gram IV stat followed by 1 gram till delivery per hour till delivery. And 2 absolute contraindications are placental abruption, either bleeding vasa previa, bleeding placenta previa, or cord avulsion.
Just one thing, because they told percent in neonatal mortality, so it should not go the message. It is not percent, it is per 1,000 live births.
Yes, sir.
Just it should not go the message of percentage.
Yes, sir. Yes.
Okay. So premature panthers, switch off your audio and video. Now we'll start with Meconium masters. Okay. Your timer starts now. First question: what is APROP?
Aggressive posterior ROP. The full form or?
Yeah. Expand the acronym CLAPSI.
Central line associated bacterial
bloodstream
infection.
Okay. How long can we keep EBM at room temperature?
4 hours.
4 hours.
What condition causes delayed separation of cord?
LED. Sorry.
Next.
Full form?
Leukocyte adhesion defect.
What is the common teratogenic effect of valproic acid?
Next.
What is the maximum amount of protein to be given through TPN?
4 gram.
Normal range of temperature in newborn baby?
36.5 to 37.5
okay.
Degree centigrade.
So time is over. So the first question answer is aggressive posterior retinopathy of prematurity. CLAPSI is central line associated bloodstream infection. For room temperature, it is 6 to 8 hours. Answer for 4 is leukocyte adhesion deficiency. Common teratogenic effect of valproic acid is neural tube defect. Maximum protein to be given through TPN is 4 gram and normal temperature range is 36.5. Okay, great. So we'll move to the next team, that is Hyperbil Heroes. Okay, Milind and Moni. Are you ready?
Yes.
Okay, so your time starts now. Your first, at which gestational age the rooting reflex appears?
28 weeks. No.
Which metal can cause Epstein anomaly as teratogenic effect?
Lithium.
The drug of choice for treatment of congenital syphilis is?
Crystalline penicillin.
Which is the most common cardiac abnormality associated with congenital rubella?
PDA.
Which test in amniotic fluid indicates pulmonary maturity?
Lecithin sphingomyelin ratio.
What is the central hematocrit value in polycythemia?
More than 65.
Which organ malformation in fetus can be associated with spontaneous pneumothorax at birth?
Lung malformation.
The predominant site of hematopoiesis in last trimester?
Liver.
Okay, your time is up. Okay, great. You have at least reached like 8 questions. Great. So the answer to first question is 32 weeks. At 32 weeks, rooting reflex appears. Metal causing Epstein anomaly is lithium. Drug of choice for congenital syphilis is penicillin. Most common cardiac anomaly associated with rubella is PDA. Test for amniotic fluid indicating pulmonary maturity is lecithin sphingomyelin ratio. Central hematocrit value for polycythemia is more than 65. Most organ malformation in fetus, which can be associated with spontaneous pneumothorax, is birth is kidney. And the predominant site of hematopoiesis in last trimester is bone marrow.
Bone marrow.
Okay. So now the next team, septic showman. Are you ready? Switch on your audio and
Yes.
Sure. Okay, so your time starts now. What is the osmolality of human milk?
Next question.
Your voice is got incorrect.
Next question.
Okay, what is the energy content of MCT oil?
9 calories.
What is the insensible water loss in an 800-gram baby?
Next question.
What is the most common tumor in neonate?
Neuroblastoma.
During neonatal resuscitation, what should be the FiO2 delivered during chest compression?
What should be the
Oxygen concentration during chest compression.
Oxygen concentration during
Chest compression 40%.
30. What is the question?
What is the last gestational
age assessed?
What is the last gestational age assessed in revised Fenton's growth chart?
44 weeks.
Okay, your time is over.
Shit, yeah.
First question, osmolality of human milk is 286 million milliosmol per kg. Energy content of MCT oil is 7.7 kilocalorie per ml. Insensible water loss in 800-gram neonate is 82 ml per kg. Commonest tumor in neonatal period is teratoma. During neonatal resuscitation, the FiO2 delivered during chest compression should be 100%. And last gestational age assessed in revised Fenton growth chart is 50 weeks. Okay. Okay. So now the next. Kindly switch off your audio and video, septic showman. And now the last team, precious premies. Okay.
Yes, sir.
Okay, great. Your time starts now. What is the neuronal cell in most vulnerable to injury in PVL?
Glial cell.
Which inborn error of metabolism presents with eczema in newborn period?
Pass.
What concentration of sucrose is recommended for oral
24%.
Which hematological component count remains fairly constant during fetal life?
Pass.
Which blood gas parameter is associated with PVL?
टाइमर ऑन नहीं हुआ टाइमर ऑन नहीं हुआ
सर किया था पता नहीं कोई टेक्निकल इश्यू आ गया सर 20 सेकंड जाने देते हैं
PCO2. Okay, जाने देना. Okay, fine.
Okay. Which blood gas parameter is associated with PVL?
PCO2.
Which vitamin supplement can prevent BPD in ELBW babies?
Vitamin A.
Which is the screening test for cystic fibrosis?
Sweat chloride test.
What is the single most powerful sonographic marker for aneuploidy?
Pass.
Gestational age in which expanded new Ballard score can be used to estimate the gestation.
22 to 37 weeks.
Okay. So time is off. The neuronal cell most vulnerable in injury in PVL is oligodendrocytes. Inborn error of metabolism presenting with eczema in newborn period is biotinidase deficiency. Concentration of sucrose used for oral analgesia is 24%. Hematological component count, which remains fairly constant during fetal life, is platelet count. Blood gas parameter associated with PVL is hypocarbia. Vitamin supplement which can prevent BPD is vitamin A. Screening test for cystic fibrosis is serum immunoreactive trypsinogen. Single most powerful sonographic marker for aneuploidy is cystic hygroma, and gestational age in which expanded new Ballard score can be used to estimate the gestation is 20 to 44 weeks. So this round is over. I will share my. Well done, all of you played very well. So I will now hand over to Dr. Prashant.
Yeah, thank you so much, Kunal. And as I already said, please stop the presentation.
Yeah.
That this is the round which is going to make a difference. So Dr. Somsekhar sir is there. Sir, this was attended by almost 100 participants, and all have done a wonderful job. The real difference was in the last rapid fire round. We are happy that Dr. Ashish Mehta sir is also there, who is visiting the venue for West Zone Neocon. We are glad that our president, Dr. Sandeep Trivedi and Dr. Ashish Mehta sir, both are actually visiting the venue. And those who are present today, please register for West Zone Neocon. This type of different quiz and sessions will be there. So it will be a better. So now over to Kunal for the scores of the last round.
Yeah, disappointing. एक दो भी सही होते ना तो शायद.
Can you share the screen? Yeah.
Tough था.
My God.
30-40 हुआ.
I mean,
70 precautions.
The Meconium Masters are the winners. 100. They scored 50 in the rapid fire. Congratulations to the team, Setu.
Thank you.
Meconium Masters.
Thank you, sir.
The second are Precious Premies with 70. So congratulations. And third, everybody is on third. The Premature Panthers, the Hyperbill Heroes, and Septic Showmen. So everybody is at third. So congratulations to everyone.
Thank you.
And now I'm opening the chat, and I mean,
you can congratulate the winners.
Congratulate the winners.
Thank you.
And even I'm, yeah.
Actually, nobody is loser.
Yeah.
All are winning.
This was very interesting. Very nicely conducted. I want to share that the team that has worked behind this quiz has been doing Zoom meetings as to how to conduct the quiz and so on and so forth. The questions have been in pipeline for quite some days. We had an earlier date set for it, then we postponed because we were not ready, because we wanted to do a good job. So I would really like to congratulate everyone involved, Dr. Ronak, Dr. Prashant, Dr. Mohit, Dr. Kunal, and so many others who were actively involved in managing it, and as well as people who gave their questions. So it was very interesting, very nicely done, and good that we shut the chat. So a lot of people couldn't answer.
Yeah,
Sandeep,
I mean, on first only somebody answered, so I just shut the chat.
वो डॉक्टर संदीप तिलवानी है, भुज का है, उसने आंसर किया था. So currently he is finishing his DMU in South India. So he should not have answered anyway.
Yeah,
Anyway,
Dr. Srishalam is want to say something.
Yeah, please go ahead.
Yeah, good evening, everybody. Somsekhar sir, namaste.
Namaste.
Well conducted quiz. I've been the quiz master in Central Zone and South Indian Pedicon. I'm saying that it was a high five method. Very good, excellently conducted. And quiz masters were excellent. They never let them sleep, I think. Sometimes, in the quiz also you get an opportunity to. So the others are also enthusiastic. Next time you keep something for
rapid fire.
We will keep for the audience also. Yeah.
Audience,
This
yeah.
took us 2 months to prepare. So next time I think we will make some for audience also. Yeah.
Yes, very good.
And
So Ashish Bhai can speak. Where is Ashish Bhai?
Ashish Bhai was there. I mean, yeah. Yes, sir.
Ashish Bhai.
Please unmute, sir. Please unmute,
sir.
Ashish Bhai, unmute. Okay. Bolo.
Yeah, it was great going. I could join a little late. Still, I'm in the car coming back from the Udaipur. But was very interesting. And I understand that last round did make huge difference. Otherwise, they are very neck to neck. So congratulations to the people who really worked on this quiz. I must congratulate the team NNF, particularly Prashant's energetic secretarial tenure. Along with that, I congratulate Ronak, Mohit, and Kunal for conducting this. Of course, Somu is always there on top of all this thing. And I was very happy to see the energy in the participants also. I mean, they are so good, rapid fire questions. The questions were good and answers were to the point. Great. Well done. All the best.
Thank you.
Just feedback from participants.
Feedback from the participant, yeah. The winners first, I mean, Meconium Masters, your feedback.
Yeah, it was a good experience. Like usually we work like very busy in NICU shifts. So, but because of this quiz, we went through some recent articles and everything, so just to keep us updated. So it was a good for academics as well. And it was very well organized. So like with minimal technical glitch. So congratulations to the NNF team as well.
Thank you, Precious Premise.
Yes, sir. It was a very nice organized session. It was actually my main part was technical part was very much covered. Rather, the whole quiz was very soft and smooth. We congratulate all of the organizer. Thank you so much for this.
Yeah, the next septic showman. Actually, I and my daughter were betting on septic showman. My daughter was saying they are going to win.
So the last round was really tough. And
Actually, that we couldn't.
one or two questions we didn't understand, but that's okay. It's all part of. But it was very well, and all the visual questions were very good.
Hyperbill, I mean, they covered.
Yes, sir. Sir, it was very nice and enjoyable session. It because of the quiz, I attend all the lectures of Neonatal Pathshala, which was previously taken, and also I will go and read further academic sessions too. So thanks a lot for boosting this.
So I must say I learned something during the quiz. When I made the questions for some of the rounds, I used dictation on Microsoft Word online, so I could type and send it faster, because Prashant was after my life ki bhejo. I couldn't type that fast. So I used dictation and it was very useful. So something you learn all the time if you do something.
So I request all the participants, please do come to West Zone Neocon. You will enjoy all this type of quiz and lectures. So everybody, I mean all the audience also. So next,
Sure.
Yeah, our next Neonatal Pathshala is on next Wednesday, same time 3:30, same link, and it is a PG seminar on BPD.